And we're live. TikTok live number 73 now. Guys, by the way, whoever stays on the longest, top 5 listeners on the live the longest, I'm giving you guys a shout out in the caption of the YouTube podcast, everything. So Lana Watermelon joined and said, did you floss today? I floss actually when I brush my teeth at the end of the day, like after dinner, going to bed. That's when I floss, and then I brush after that. In the mornings, I just brush. I don't floss all the day, every day. I floss once a day. That's before I brush, before I go to bed. Geoffferson S, Raskin, and I floss before brushing. Guys, I don't know if you know this, but like getting all the cracks, all the gunk out of your teeth, maybe getting some food caught out, that helps you brush in that space where that food just was. So I recommend flossing before you brush, by the way. Geoffferson S, Raskin said, had a case with an oral surgeon the other day. Saw my first zygomatic implants being placed. Really interesting. Yeah, they are interesting. It's a pretty invasive procedure, right? Get them all the way up into the zygomas over here in the cheekbones. Yeah, that's a fun one. Anterior venous malformation said, I met one of the neurosurgeons on TikTok in New York City. Oh, who? Which neurosurgeon did you meet? Maybe I know them. So Lana said, makes sense. It makes sense, right? It was a periodontist, Dr. Georgios Romanos. I got to give him credit for that. He said, you got to sweep the streets before you polish, right? I think it makes sense to floss before you brush in that metaphor, you know? Geoffferson S. Grasson said, the surgeon asked to keep the eyes exposed. What is the purpose of that? Keep the eyes exposed, like what was a patient having a seizure, or what do you mean keep... I'm trying to understand. I mean, you can assess someone's. Sometimes it can help you understand if someone's having a stroke, if someone's having some type of cerebrovascular event based on the pupils and their eyes and dilations and stuff. That helps with like seizure and certain activity there. Hot Debate Cut said, hi from Canada, Montreal, new dentist here. Congrats. Hi from Long Island, New York. What's going on there, friend? Dave Villon said, hey, currently a pre-dental student in second year. What are your thoughts on military scholarship? So I didn't do the military scholarship, right? But everything is so astronomically expensive these days. I don't think it can hurt. Now, you need to understand that once you take that scholarship, you're committing some time to them, right? Maybe service, maybe whatever that may be for them. I don't know. I don't have any more details than that. All I know is that whatever you take as far as like years of stipends, of scholarship, of tuition, you have to pay that back in time, right? So you owe them, say you take 4 years. From what I know, you owe them 4 years. So that's something to consider before you take a scholarship. But I think it's a great idea. These days, it's like now you pretty much have a job for 2 years before you. So I think there are worse things in the world. Sophie Gomez, what's up, Sophie? She said, Sophie said, did you feel like you had time for friends and family in residency? Is it worth it? Well, is it worth it is based on like, is the end result worth going through all that, right? And no, you really don't have that much time for friends and family in residency. You're taking sacrifices left and right. I would wager you don't have all the time in the world for friends and family in dental school as well. And residency is even less than that. Is it worth it though? I mean, it depends on, it means to an end. I need to see what it's like. I need to work for a year or two before I can really answer that question. Right now, as we know, the reimbursement of dentistry by insurance companies, and reimbursement just in general, whether you're fee-for-service or you take insurance, everything in dentistry has gone down since pretty much insurance became more mainstream in the 70s. And there have not been increases in reimbursement since the 70s, 80s, 90s, 2000s. So, it's just constantly losing battle. All the costs of everything else have gone up over time. Tuition, cost of materials, dental products, alginate, implants, crown, everything goes up, right? Why the reimbursement from the insurance companies to the dentists have not gone up. And it's also another thing, like you're asking, like, is it worth it? If you look around, like, trust in providers is at an all-time low. I had a conversation last year with a dentist in the Boston area, and she was saying how, like, every day she goes into work, it's like patient trust is at an all-time low. You're constantly fighting an uphill battle, and it's frustrating. It's frustrating. This isn't the dentistry I was sold on by my mentors. They all own their own practices. You know how hard it is to own your own practice nowadays? Not even just starting from scratch, but the opportunities to buy into a practice have gone down significantly, especially in the bigger city areas. So, look, that answer is yet to be told, but we will see. I love surgery. I love oral surgery. That's why I went into it. That's why I finished residency, and I'm about to start working. It's constantly a battle. I mean, that my second part of not even part one, forget about part two boards was $3,300 just to register for it. I haven't got a paycheck in over 2.5 months. It's tough. Oh, they say, well, it's all going to be worth it in the end. Well, the opportunities of what makes it worth it in the end have only gone down, have only decreased. Hey guys, it's frustrating. And, going into dentistry and healthcare professions in general, expect to be frustrated frequently. You're constantly frustrated with something. And I don't know. I'm waiting to finally see a winning battle. You know what I mean? Because it's a win enough to graduate dental school and then get through an oral surgery residency. But what about a win when it's like quality of life finally repays for all the years of sacrifice, all the tuition payments, so that's what I'm waiting for right now. That's when you can probably hear the frustration in my voice. So that's what I'm hoping on. I'm hoping on things to finally pay back. The light at the end of the tunnel, I'm still looking for it. And it should come. It should come. But like, how old do I have to get? I'm 31 years old. I just graduated residency. When does it finally come? 32 years old, 33 years old, 35, 40. I'm waiting for life to finally get comfortable. So we'll see. Sophie, I know you asked the question. I gave you a little bit more than that. I went on a big hot topic rant right there. But hey, I'm speaking from the heart. And I'm sure a lot of people would agree with me. And some people would disagree. Some people have it made. One thing I can't stand is these people that sell out their 3, 4, multi-practice, whatever, to DSOs, and then they're telling everyone it's the best thing in the world. You can't talk anymore because you sold out. You sold out. No one can make that money that you just made by selling a practice. Or like anyone that buys into your practice that you just sold will never make the amount of money that you made ever again. That's something that I think we have to consider, with this DSO. And DSOs are for some people. Some people have excellent opportunities at the DSO. You want to come in a little bit late, leave a little bit early. You don't have to invest anything into the marketing, into the business, it's just you coming in, you do your work, and you leave at the end of the day. That's good. Maybe you could get a 3-day-a-week gig, although I didn't see anything in the tri-state area, like a 3 days a week at a DSO. That would be pretty fire. But no. And look, I want to have skin in the game. I wanted to go into this to get a stab at ownership. I wanted to own a practice one day with partners and be a team aspect in treating patients in the community. So anyway, I hope I can achieve that. I'm going to keep working towards it. But I hope everyone has the opportunity to find what's perfect for them, And I'm trying to create that. I'm trying to create it and go from there. User 17409, any CE recommendations for a general doc trying to get comfortable with extractions and bone grafting? I don't know. I don't know if CE is recommended right now. I just finished residency. I haven't done any CEs like that. That's a good question. Did you do residency? Because first, if you're a general doc, I mean, hopefully you did a GPR residency, but then, I don't know, and extractions and bone grafting, that's, I don't know. We group these specialties into boxes. It's like oral surgery, extraction, bone grafting, but general dentists do extraction and bone grafting, but like, I don't know, if you don't feel comfortable with it, then that's kind of the cue to refer out, right? And I understand you need to make a living and stuff, but I don't know. I don't know about just going to a weekend course to get CE and feel comfortable with like implants or extractions and bone grafting. So I don't have the answer to that. You know what I mean? But as far as comfort goes, there's also a fine line of like referring out. You know what I mean? Tier Venice Malformation said, Mark Hoffman, he said he's doing a fellowship there for tumors. I was in awe. Oh, interesting. Fellowship in New York City. He tried to do TikTok. Cool. Goober said, are you a UF fan? So you rocking the merch recently? My cousin, Aiden Warner, he's the second string quarterback on the Gators. They have a game next Saturday, the 30th, August 30th. They have their first game in their home opener. He's probably going to get a lot of time. I hope I get to watch that. But yeah, I am a fan now. I gotta watch. I haven't watched much games through residency, but yeah, he's on the team now and he's the second string quarterback. So yeah, I'm a fan. Geoffferson S. Raskin said, I was going to wrap the head after intubation. OS wanted to see the eyes. My guess was for Oh, I thought you were talking about the neurosurgeon. Sorry, Jefferson. That was different. Sorry about that, Dr. Raskin. So you were going to wrap the head for intubation. Also wanted to see the eyes. Yeah, that's correct. That's for landmarks. Yeah, I thought you were talking about a different guy, neurosurgeon. And I was like, seeing the eyes. Yeah. No, but you're right there. Hamza said, as a UK dental student, would you say to take the second-year DMD conversion program or AEGD? With the AEGD, I don't know if where you're going to be able to work with that. So I don't know. Why you don't want to be a dentist in the UK? I'm not sure. Is that not good? I don't know. Ovux Sir 44 said, what watch are you wearing? This is a Citizen. It's a ProMaster diver, but a day date too. I love divers, and I also love day dates. The day date is when it has the day of the week. This one has the day of the month. And the diver, you can time using the bezel. It spins around. So you can get most things that you're timing are up to 60 minutes. I time like everything I do when I'm driving over here, when I'm doing the laundry. Speaking of, I just put that in 10, 15 minutes ago. So I'm timing that. I'm going to put that back where it was. Jefferson S. Raskin, even though you work for practice now, do you ever want to start your own? Yeah, I might want to start my own. I got to see how this goes. I got a 2 years associate contract. I'll be at the Melville office with all county oral surgery, and I'm hoping it goes great. I'm really hoping it goes great. And if it doesn't go great for any reason, I'll let you know about it, and then I might have to open my own practice or look for somewhere else. I don't know. I'm not hoping for that. I think it's going to go great. I really hope it goes great. I'm working for Dr. Raskin. He owns the multi-practice. He has about like 8 or 9 surgeons working for him and like eight or 9 practices. And he's the sole owner. So we'll see what direction he wants to go with it. And I'm really hoping for the best. I'm really excited to get started on the 2nd of September. And it's a private practice, so yeah, I'm hoping for a really great opportunity to continue, Dave Velion, what specialties did you consider other than surgery? Just oral surgery. It was either general or oral surgery. I wasn't considering any other specialties in dentistry. I wasn't interested in any other specialties in dentistry. Hamza said, as a UK dental student, would you? I don't know, Hamza. I don't. If you want to work in the United States, you really kind of need to do that 2-year DMD conversion program. Okay, and it might not be DMD, it might be DDS. Remember that. DMD and DDS mean the same thing in dentistry. Geoffferson S. Raskin said, it's almost impossible to start your own practice with amperage salaries and school loans. You're right. You're 100% correct, Dr. Raskin, and it's very concerning. It's really concerning, especially in areas like California, New York, Massachusetts. New Jersey's tough, but can be done. Which externships were hands-on versus observing? NYU is hands-on. Montefiore is a little bit hands-on, a little bit. Very tiny bit. NYU is very hands-on. I did VCU, and VCU was not really hands-on, but a little bit. I mean, we could assist in the OR. Montefiore was assisting in the OR. NYU was doing stuff and everything. Okay, those are the 3 externships I did: Montefiore, then NYU, and then I did VCU. All right. ATX. My dentist got mad because I told him he's not a real doctor. Wow. Well, why'd you tell him that? I mean, what are you getting with there? All right, let's keep it going here. Zayeda 3Mr. Surgery residency demands a specific GPA in the U.S. Not necessarily. You should be having a good status with your GPA, but it's not like it demands a specific GPA in the U.S. Jay the Super. Hi, what's up, Jay? Hey, Brandon, good to see you. It's Jay the Super. What's up, Jay? How's it going? Where are you at now? You're in the Bronx, I thought, right? How's that building going for you? I'm out in Smithtown now. I'm no longer in the Kips Bay Carmel Place building. I really miss having the gym in the basement there. Not gonna lie, I really. And plus, I miss I had everything right where I needed it, like an arm's length, Daryl, ever have considered registered nurses who decided to go in the dentist route? I believe I have, yeah. A couple people on the TikTok Live over the years. I've been doing this for like 2.5, almost 3 years, guys, doing the TikTok Lives. Actually, I have been doing them for 3 years now that I think about it. This is TikTok Live number 73. But yeah, it's usually like dental hygiene or dental assistants going to dental school. But sometimes, I think there were 2 nurses over the years, yeah. Emoji said, have you ever heard of the dead internet theory? No, I haven't heard of it. Youssefhakim said, do maxillofacial career work in the surgeries a lot, or is there not much work and most of the time dentist? Yusuf, I'm sorry, I'm not understanding that question. Daryl followed the live creator. Thanks, Daryl. Vishna said, any advice to a pre-dentist student whose goal to be where you are? Yep. Expect a lot of sacrifices, expect a lot of time commitments to studying, to saying no to seeing friends and family on weekends, studying through dental school, undergrad, so many exams, so expensive. The career path is very long, and it's a multitude of sacrifices you need to, unfortunately, accept in order to get there. That's what I would say at this point, Where are we? Yeah, so that's that. JoeyAKA-HOMELANDER said, please don't be a Tylenol ibuprofen only doc, though. Well, you probably don't know. Do you understand how hard it is some of these states are getting on people to prescribe opioids? I'm hoping after you get 4 wisdom teeth removed, especially like full bone impactions, got to do a lot of drilling, maybe a coronectomy. Yeah, I think you should be able to prescribe 5 of Oxy, maybe 10 of Oxy, get someone through 2 or 3 days, right? But after that, once you get to around like a week's long of opioids prescribed, that's where you can really get into that dependency range from what I've seen. And we don't want that. We're not trying to cause someone to have dependency on any type of medications, right? So generally Tylenol, ibuprofen, especially extra strength Tylenol on top of ibuprofen, like 600 or 800 milligrams, they say in the literature that does help someone manage pain as good as, if not better than, like Percocet, So just something to keep in mind. But no, look, I'm hoping to get my license so I can prescribe the DEA. That's, to prescribe controlled substances. I think I have that now. But yeah, so user 174 said, have you done any volunteer work doing extractions during or post dental school? Yes, so I have. I went to, this is almost 2 years ago, I went to Jamaica and I did a week long of a lot of extractions in Jamaica near Ocho Rios. That was a good time. A lot of work, very hot, sweating everywhere. Also during dental school, I was supposed to go to Madagascar, but then 2 months later, COVID was ramping up when we were planning to go to Madagascar with our meetings and stuff, and it got canceled, unfortunately. Yeah, it was going to be Madagascar, dude. When are you ever going to get to go to Madagascar again? You know, like Scoobu said, what's your thoughts on dental anesthesiology specialty? I think it's great. I don't know the concept of like they're working in the hospital setting, but do they get hospital access to be an anesthesiologist there easily? Do they have to do they get pushback? I know that some dental insurances don't accept dental anesthesia as, it's like they bill out one or the other. You can't bill both kind of thing. I get that question a lot. I don't know enough about it. I'm sorry, Scoobu. The Disney DVM said kind of like DVM and VMD, only one went to Penn. Huh, I don't get it. Joey, aka Homelander, like it drives me nuts. We don't give opiates on ibuprofen or Tylenol. I'm sorry about that, Joey. I don't know what to say, man. Jane Salt, do you do total joint replacements? I do not do total joint replacements. User 1740, any websites that have helped you look at existing or possibly coming up offices for sale? I don't know. That's a great question. I don't know. Really, it's just like word of mouth as far as what I know. The Disney DVM said, and they say vets aren't real doctors either. SMA. I don't know. Walla01 Wallow, you're beautiful. Mischa said, is hygiene a good career path to go into? It is. Dental hygiene careers are very good to go into. They are. Now, expect you're not going to own the practice, but yes, they are good. Walla01 Walla said, can you prescribe me some? I need a prescription, please. Youssefhakim said, sorry, I meant that. Is the fact of OMFS, what is the nature of the job? Is it always surgeries? Yeah, it's generally always surgeries that we do in oral surgery. We do everything from extraction of teeth, wisdom teeth, IV sedations in the office, dental implants, bone grafting, sinus lifts, all the way to hospital setting stuff, full joint TMJ procedures. But you should really be in a hospital setting for that. Arthrocentesis, arthroscopic lavage of the jaw of the TMJ. We also do jaw surgeries. We do orthognathic surgery, Lafort or BSSO of the mandible, where we move jaws forward, back, take off excess jaw when they have like protuberance of the jaw and stuff. Neoplasties, where we do the chin. So there's a wide range of things that we do in oral surgery. The Disney DVM said, gotta renew my DEA license this fall. Ugh, so much money. Yeah, dude. And $88 for that. $100 for the second part of the oral surgery boards. It was another like $800-900 for my New York State license. It might have been $1,300. Is that 15? It might have been $1,500 to get my New York State license. Yeah, dude, I have no money left. I haven't worked in 2.5 months since I graduated residency. I got nothing. Scoobu said, do you think dental anesthesiologist is a good specialty? Geoffferson S. Raskin said, you were at Jamaica Hospital? No, I was in Jamaica. I was in Jamaica at Ocho Rios. OS, what watch you have on today, Doc? This is the Citizen ProMaster Diver Day Date. Dude, it's like not expensive. I got this band on Amazon. The band is like $25. It's a class band. So it goes on and off really nice and easily. Waterproof. It's like a glove. It's perfect. And the watch is Citizen ProMaster. It's like a $300 watch. Very affordable. You can swing it. This is one I planned. This was my final Chief Year watch. I got this for $300, $325 for finishing out Chief Year. This is a blue one. So I bought this one after I graduated for like weekends. And then I have the black one for work. And I have like 7 watches. Most of them are pretty affordable. But I like to switch watches based on my mindset. You know, if I'm preparing for something, I like to get it. Or I know Kevin O'Leary likes to get it for like graduation gift or marriage or stuff like that. But I like to do it to get my mindset in the zone for a particular focus that I'm looking for. You know what I mean? Like if it's a weekend watch, just to relax. You know what I mean? If it's a weekday watch, I have it for a certain purpose, whether it's like for work during the day or I got one like has a moon phase. That's not really one of my work watches though. And AliGirl73 said, hi, I'm so glad you're legal now. Mom must be so proud. Dentist to work in New York State. Yes, she is proud. I saw her this weekend. We just got back a little while ago. Her birthday's tomorrow. Happy birthday, Mom, on the podcast. Let's see. The Disney DVM. You talked about DDS and DMD. Yeah, they're the same degree. Now, they say literally different things, like DDS is Doctor of Dental Surgery, DMD is like Doctor of Medicine Dentistry. But essentially, they're both general dentistry degrees. When you graduate from dental school, you get either DDS or DMD, but they serve the same function and purpose, okay? So I wouldn't get too bogged down on like the meaning of the difference between them. All right, Geoffferson S. Raskin said, thanks again and best of luck with All County. Thank you. You're around New York City and LI, maybe see you out there. Yeah, man. Jefferson, Dr. Raskin, I'll see you out there. Come by and say hello. I'll see you in the field. Dude, tough LOL said NC ain't a vet. What do you mean? User 4623 said, can I shadow you? I'd like to put it on my application applying in October. Yeah, in October, I'll probably, because I start working on the 2nd of September, and I got to learn like the computer systems. I got to get my feet down in the office, get comfortable in the day in, day out. But yeah, after that, sure, maybe October, November. Daniel, I know it might not work with your timeline, but that's, October, November, it's the earliest I'm really going to be doing that. Daniel Smith said, what was your GPA in high school? Man, that's way back. I don't know. Great question. I don't remember. Joey, AKA-HOMELANDER said, is there any tooth you can't pull? My wisdom tooth is gone. Just bone below. No, I'm pretty confident taking out most teeth, all teeth in the mouth. Yeah. Yep. Yes, I am. But there are certain teeth you don't take out, right? If there's for a certain reason, why would you take out a deeply impacted tooth if it's not causing any harm or not looking like it's going to erupt, for example? TikToker said, I'm coming from a pass-fail school with med curriculum. Do programs expect higher CBSE scores? I know some people have said that in the past. Look, just get the highest CBSE score that you can get, okay? Good letters of recommendation. Do externships at programs. Get the best GPA and rank that you could get. That's what it's going to come down to, okay? Get the best CBSE score you can get. User 17409 said, on mandibular molars, do you elevate on the buccal side, assuming less, none on the lingual? Well, which mandibular molar are you talking about? Are you talking about the third molar, where on the side of that lingual plate that you could fracture off by doing that, where the lingual nerve is, and you could traumatize that lingual nerve? Well, no, I don't want to injure the lingual nerve. There are sometimes where that tooth has a lot of buccal bone on that side, on the buccal ridge, and sometimes you can elevate off that, especially if it's not leaning towards the tongue, and you could potentially fracture off the lingual plate. So potentially, it really depends on the clinical situation. You know what I mean? I can't say yes or no for most cases or not. You see what I'm saying? Youssefhakim said, I respect you very much, doctor. Thank you for your response. Yeah, you got it. Youssef, you got it. Let's see, we got, next one is JoeyAKA-HOMELANDER said, I would love to show you how bad my tooth is. It's gone by my wisdom tooth. Sure, I come in for a consult, man. Youssefhakim said, last question, if you would give surgeries on the specialty percentage, what would it be in work life? If you would give surgeries in this specialty percent, I'm not understanding that question. I'm sorry, Youssef. Would you be able to rephrase that for me? Just one more time. I'll try and do it from there. User 4623, what was your rank in dental school? I hear that OMFS residency want the top 5%. Is that true or myth? Generally top 10%. It really depends on your letters of recommendation, your CBSE scores. It depends on your externship trail. It really depends on your overall application. It's not just like what your rank is. It's not just the CBSE. You see what I'm saying? So there are a lot of things that go into it. I would remember that. Adam.Illusory said, what are the disadvantages of not specializing through residency and doing a bunch of CE courses instead? Well, the liability would be one of it. I think a lot of people that do CE courses they're doing CE courses on things that are out of their scope, right? They're trying to do excessive implant dentistry. They're trying to do certain maybe sinus lifts, certain bone grafting in certain areas that might not take well. Some CE courses, they stay in the range of general dentistry or other specialty areas that are fine. But I think it depends on the purpose of what you're trying to do that CE for. Does that make sense? You could do a bunch of CE, but I would just remember, make sure you're doing right by the patient. That's the most important thing. And I see a lot of people going to CE courses to do some cowboy surgeries. I don't really like the idea of that, you know? Adam Illusory said, what are the disadvantages? K-Riss E said, it's more than stats. You want to be well-rounded. Back to this, right? Geoffferson S. Raskin, take care. Take care, Dr. Raskin. I'll see you soon, man. I'll see you soon. Shura said, at JoeyAKA-HOMELANDER, a well-trained doc will still be able to help you. Pratik said, what do you think of Montefiore's OMFS program? I think it's an excellent program. Very strong program. I have a lot of friends that went to Montefiore and came out of Montefiore. Speaking of Pat Monahan in North Carolina, he's a good dude. He's one of them. He's a Montefiore grad. And next we got Cali Girl 73 said, great to hear you got a job right away. I did. Yeah, I signed that job a little over a year ago. Yeah. JoeyAKA-HOMELANDER, I will be coming to see you. Your last faith left. I'm petrified of dentists. Well, we'll take it easy, right? I don't want you to get all worked up. I have to take a look and evaluate this consult, and we'll go from there. All right, we'll take it one day at a time. It's going to be all right. Ford said, Doc, have you considered fighting in the UFC? You know, I have not considered fighting in the UFC. I think it's more, I have more of a chance doing surgery on UFC fighters in the face. I've actually done that in the past when they went over to the City Hospital in Manhattan, and I would do it again for sure. Yeah, I think the lacerations came out great. One of them even followed me back on Instagram. Yeah, I think they liked the way it came out. Yeah, I would definitely do laceration repairs on UFC fighters. That would be fun, and I think I could do a good job helping them. Girl 73 said, my 30-year-old just got his one wisdom tooth pulled. Will he have any more grow in now? Well, I don't know your 30-year-old personally, so I don't know his x-rays. I haven't examined him clinically. But generally, if you get the final wisdom tooth, your permanent third molar removed, generally there's no more that grow in. But there are plenty of there's a small percentage of cases where people have supernumerary teeth, where I've seen people where they have like 2 wisdom teeth in multiple quadrants even. So yeah, and then there's syndromes where people have multiple teeth. So you can't count it out, you know what I mean? So I don't know your 30-year-old specifically, but that's something to think of. Joey, AKA-HOMELANDER, said, and one last time, what office in Long Island you'll be at so I can save it? Yeah, I'll be at the Melville office at All County in Oral Surgery. So it'll be in Melville, and the office is called All County. All right, I start on September 2nd. So yeah, you can call, get a consult, and I'll be happy to see it. Yeah, let's come on in and take a look. ID, follow the live creator. Thanks, ID. Ford said, Doc, did you delete your video about Mooney, and if so, why? Yeah, because people left comments that just took it the complete wrong way, and it was like pretty inappropriate. And we had a podcast that went through all the scenarios, comments, everything about specializing, not specializing. Yeah, it is what it is, you know. And I was trying to make a joke with it, and Mooney's a good kid, but no, it's the podcast will be what I would recommend going to. CaliGirl73, agree on that. Stay in your field. User 174092. What YouTube channel do you recommend for extractions and implants? I would recommend Dr. Wahan. His name's Serv Wahan. He is in Seattle. He's one. You could also look at Bloody Tooth Guy. Bloody Tooth Guy's oral surgeon in New Jersey. He's great. Dr. Jason Auerbach. There's another one. Ali, I forget Ali's last name. But those are a couple I would look at for now. You also have Surgical Gourmet. He's in Orange County, California. He's got some good videos, but the other 2 guys they take focus videos on those. You know what I mean? All right, we got Bag525. Can you name a good cosmetic veneer course and a good OS extraction one? I don't, unfortunately. I'm sorry. I don't know in that direction, unfortunately. User 4623. How much is a starting salary for an attending OMS in a hospital setting in New York State? You know, I didn't look at any attending positions because I don't want to be an attending in a hospital. They're not going to pay you what you're worth. They're not. You're going to have to do a lot of work. It's going to be a lot of work, underpaid. You're going to be facing the bureaucracy of the system, so every day is an uphill battle for you. I don't know. I don't know. I don't know what they would be. They're significantly lower. I would expect in the 200s, maybe low 300s. Probably not though. Probably mid to high 200s. Yeah, and that's. I think it's like low within the 200s, low to mid 200s. So Sebastian said, have you removed a broken implant abutment? Yep, done that. Been there, done that. Youssefhakim said, asking about the proportion of time OMFS spends performing surgeries versus doing non-surgical. Well, there's going to be a lot of time. No matter what profession you explore, any career specialty, there's going to be a lot of paperwork. There's going to be a lot of downtime, follow-ups, consults, and stuff like that. But you're going to do a lot of surgeries too. All right, but I mean, you gotta take notes. You gotta document. EJD said, hey Doc, when are you starting to work? I start work on September 2nd. Yeah. Finally. Pal said, do you think perio is good to go into? I heard that if you like the surgeries, just do OS. Yeah, I mean, they're going to be doing all solely dental-alveolar, right? So they're not going to be doing, perio's doing solely dental-alveolar extractions, implants, but they should be doing a lot of gum surgeries, right? The whole point of periodontics was a profession to create was to preserve and maintain the periodontium, right? So going in a different direction a little bit there, right? Pratik said, what does Montefiore focus on? They're not full scope. No, they do benign. They don't do any malignant cancer. They do benign pathology, and they do mostly dental alveolar, but they do a lot of orthognathics. They do a lot of, they do a big scope, but it's not full scope. They do plenty of implants. They do some of the most implants of residencies that I know about. Yeah, so that's something to consider. 73 said he needs his teeth. Wow, thanks. Yeah, you got it, Kelly girl. The Homelander said, thank you. You got it. Davida said, favorite part about OMFS residency? I think some of the people that you go through OMFS residency are a big part of your support system, your team, you're in the trenches together. Another thing is learning the big implant cases, all NX cases. The VA rotation was, I think, my favorite one. I like the dental school, a lot of sedations there, a lot of dental VLR at NYU Dental School, but the VA, Manhattan VA, was a good time. And I learned so much with Dr. Orentlicker there as my attending, teaching the implants in all NX cases. That was zygomatic implants, IPS cases, really good time at the VA. Yeah, so that was probably my favorite part about oral surgery residency. And Youssefhakim said, thank you, doctor. Looking forward to learn from you, such a legend. No, you're too kind. You're too kind. Pratik said, I want to extern at 4-year programs soon. What programs do you recommend? Sure. On the East Coast, I would recommend especially Montefiore, VCU, ChristianaCare, MedStar, Rutgers, and yeah, maybe you get NYU or Kings County in the mix too. Those are some really good programs to look into, okay? User 4623, UPenn is a fantastic, highly recommend. UPenn's only 6-year, by the way, so not a 4-year. And UPenn, you should really look into their scope and what they're doing over there. A lot of co-residents went to UPenn for dental school, and they didn't rank it as highly, you know? So, something to consider. All right, guys, I'm going to be signing off. This is TikTok Live number 73. Thanks, guys, for coming on. The top 5 listeners, I'm going to be giving you guys a shout out in the caption of the YouTube and podcast. Okay, so the full version I put out, you guys are going to be in that caption as my shout out. All right, guys, thanks again. Have a good night. Have a good week. Let's make it a great week. All right, let's make it a strong week. Let's go get after it. All right, thanks, guys. Love you.